Welcome to Sex in the News. We are the Siegel brothers. Tonight we'll be talking about benzodiazepine use before conception, the increase in Chemsex, and Him Too, a case report on male sexual violence.
So, what do we have for our first story here?
This is interesting. A study showing that use of benzodiazepines, drugs like Valium, Xanax, and
Klonopin,
a host
Ativan.
of others, before conception increases the risk of an ectopic or a tubal pregnancy,
Yeah.
which is
Significantly increases.
potentially life-threatening. Yeah, 50% higher
Yeah.
risk. That's significant because just like, we used to say, in women who party really heavily, hard drinking women
Yep.
have to be good contraceptors because the window for fetal alcohol syndrome, even though it takes a lot of alcohol,
Right.
it's before a woman even knows she's pregnant. So if a woman finds out she's pregnant and goes, "Oh, I have to stop partying and drinking," it's too late,
Yeah.
right? If she's drinking to that level. So here, if a woman's like many people use long term these drugs for sleep or anxiety or mood, if you can become pregnant, not necessarily planning to be pregnant, but if you can become pregnant, you got to be careful
Right.
with these drugs because a tubal
Yes.
pregnancy can burst, and that's like a burst appendix, and it's a 911 thing,
Right,
and has to
right.
be
Can be life-threatening.
surgically removed.
And let me throw something in there too, because again, it's an important takeaway in a lot of that especially women who are in their reproductive years really need to talk to their doctors about going on those medications,
Yeah.
and if they're on them, they have to continue to talk to their doctors about how long they should be staying on them. Nobody should be on these drugs for any kind of long term. And the kicker is that most of these prescriptions are refilled by physician's assistants, nurses, not the doctors. Once the doctors prescribe them, they almost
It's in
never.
the chart,
That's
so
right.
they can renew it.
That's right, and they almost
Yeah,
never
forever.
talk to the patient again
Sleeping
about it.
meds,
Yeah.
anxiety meds.
Yeah, exactly. So, it is really, really important that you do talk to your doctor about these drugs. They're not harmless, they're not recreational,
Right.
and especially in childbearing years.
This is they note also that use of these drugs during pregnancy increases the risk of a miscarriage and developmental outcomes for the child.
And that
Just
we've
like
known.
alcohol.
Right,
Yeah.
exactly.
It's they're downers. They're central nervous system depressants.
Right, but this ectopic pregnancy risk, especially that significantly high risk, is something that we really have to think
Right.
a little bit more seriously about.
Should we include a public service announcement about chlamydia as well? And the risk of tubal pregnancy?
Yeah.
Right? Remember, chlamydia is more likely than not to have no symptoms. So anyone who's sexually active should get tested for STDs on the regular. What, every 6 months or something?
It depends on how sexually active they are.
Yeah, especially if you're planning a pregnancy
Right.
later on,
Right.
and you have scar tissue in your fallopian tubes because you never knew you had chlamydia.
Exactly.
That's a problem.
And might as well also throw in that is still the leading cause of infant blindness as well.
Oh, ew.
Right?
Yeah. Don't they still put silver nitrate drops in babies' eyes when they're born?
Not silver nitrate, but antibiotics. Because
Something-
because ocular
something just in
gonorrhea
case,
is also
right?
really
Yeah.
really high. Yeah.
Used to be syphilis in the old days.
Yeah.
Ew.
Okay.
Unsexy.
Yes.
Okay. Well, it's supposed to be sexy, but it also turns out to be very unsexy. This piece on a rise in what's known as chemsex, or sex while using drugs.
Right.
There's even chemsex porn,
Yeah.
right? This is mostly among among men who have sex with men, and it's usually crystal meth. But it could be anything on the whole menu.
And I think
right?
what this study was showing, and this is also again earlier this year, that when we talk about the issue of chemsex or drugs and sex with men who have sex with men, right? That sort of CDC clinical MSM term. We have always really talked about these cocktails that are so popular in
Right.
gay clubs. The crystal meth, Viagra, Red Bull, and vodka.
GHB is making a comeback.
And that's the thing. And if you look at the numbers on here, when we look at chemsex, drug use, recreational drug use, not including cannabis, cocaine, and heroin, right? So
Right.
when we're looking at the quote club drugs, right? There's been, I think, between 2007, I think it was, and 2017 that this study was looking at.
Right.
For people in general, it's been a steady 9%. It has remained stable. But when we look at the numbers for men who have sex with men, it has almost doubled.
Huge.
Right? It's almost doubled.
Right.
And when you, like you said, the crystal meth, the GHB use that is on the rise, still along with the cocaine and MDMA, or what people still call ecstasy, plus the Viagra, plus the alcohol. I think people really need to take another look at that. But the real kicker is the relationship between that kind of drug use and unprotected sex.
Yeah.
And that's the real kicker. And I'll tell you something that does kind of concern me a little bit. And I do wish people would talk a little bit more about this. That let's tie that into PrEP.
Yeah. This comes up often, right? Are we being a little cranky and conservative? That we're concerned that for a lot of people this is like a license to fuck all and not use a condom.
Exactly. And just to explain, if people are not quite clear, PrEP is a term for what we call pre-exposure prophylaxis, which means prevention related to HIV. It is a combination of drugs that it really has shown to be very effective at preventing HIV. But it doesn't prevent anything else from being spread.
Like syphilis and hepatitis and everything else.
Right, and that's the old guy rant, right? And it's like, okay, fine, you get this that prevents HIV transmission, but it's not licensed for unprotected sex.
Right, and I'm sorry, but if you're smoking crystal meth, you're not conscious of protecting yourself from risky behavior.
Right.
You're looking for risky behavior.
Right, exactly.
So it's kind of more rougher, maybe. In some circles, anonymous hookups, polyamorous situations, but it's centered around the partying thing.
Right.
Now, our friend Doug Braun Harvey talks about sex and drug linked behaviors.
Right.
And that could run the gamut across whatever drug. But this one is the hardest. I've seen a number of these guys in my practice. This is the hardest sex drug linked behavior to unlink because these guys go, the thought of having sex ever again without meth is like, ain't gonna happen.
Right.
So that's a big challenge there.
Exactly.
With treatment.
Right. And we can never underestimate
And relapse.
the impact that alcohol has underneath all of this as well.
But meth is one of those cravey drugs like cocaine on steroids.
Yep.
That is really not so hard to quit, hard to stay quit.
Right, exactly. Right. Easy to get off of, not easy to stay off of.
Right. Yeah. And our last piece?
Our last piece is basically, and I kind of like just even starting with the title, talking about, again, we've been hearing for months, and rightly so, but this whole Me Too movement about women finally coming forward in the numbers that we've seen.
It's years now.
Right? Well, yeah, since I think, 2017?
Yeah.
And we've seen a lot of people.
A lot has changed in the world.
Exactly. Been held accountable. Some, caught up in the, let's just say, the moment, as it were. But a lot of people really kind of held to account. However,
Al Franken should be in the Senate.
Yeah, no kidding. He was a casualty. But one of the things that has not really been included, at least to the level that we need to include it, in all of the Me Too stuff that we've been hearing, are the him to's. The number of cases where men are the victim of sexual violence and sexual assault.
Yeah.
Men are victims of sexual assault at a rate almost as high as females. According to the CDC, about 36% of women report being sexually violated. Right? And when I say violent, I mean experiencing sexual violence. It's actually a better term there. Say experiencing sexual violence. But 33% of males do also.
Wow.
And most men are basically raped and sexually abused at the hands of other men. Right? Sometimes women, that's another myth, we should do a show on that.
Men can't be raped.
How men can be sexually coerced and forced into sex by women. But the myths, and when we look at the impact on men psychologically that do report it and are not believed, that's where we see all kinds of stuff. And the thing that we have to look at as well, that urologists and general practitioners have to start asking questions about men and starting to look for these red flags in these unexplained genitourinary type of issues.
Injuries. Yeah.
Yeah. You know, and that
We
could
should,
be
we should call our dear old friend Steve Braveman in Monterey, who's been working with adult men victims of sexual violence for the decades that we know him.
Yeah, absolutely. Absolutely.
Well,
So we need to bring this out of the shadows as well.
Indeed. And as usual, we like to finish with a little piece we call Poetic Justice, pointing out hypocrisy wherever we can find it.
Yes, indeed.
Strangely enough, it's been a quiet week for sexual hypocrisy. So we're digging back into the annals of sexual
Indeed.
hypocrisy history.
And before you go, I just want a little sort of redirect. Not so much that's not anything happening, but I think this is something that really kind of broadly goes out to the entire group and party that this guy was a part of. That this really speaks to such huge, systemic hypocrisy.
Yeah, we've been talking about this for years. People think medical information must be free of bias because it's medical. But when all of these doctors are right-wing fanatics and religious zealots,
Yes.
yeah, we go back almost 20 years. I was still with Planned Parenthood when this happened. A physician, an OBGYN named David Hager, who was a Christian anti-abortion activist OBGYN, that George W. Bush appointed to the FDA's Advisory Committee for Reproductive Health Drugs in 2002.
Which was a storm of controversy right then and there because of this religious anti-sex, anti-birth control stance.
Put in that position, right? I had the pleasure of meeting Susan Woods, I believe her name was, who quit in outrage and disgust, who was on that level, on the Committee for Reproductive Health Drugs. I remember how she explained it, that it's always a pyramid. And this was such a no-brainer. This was about the approval for Plan B, which back then was still called the morning after pill,
Right.
which now is like the 3 or 4 mornings or even 5 mornings after. But at that time, it was up for approval, and it was approved like in a matter of days at every level of this pyramid in this committee of the FDA, except at the top. Bush's guy at the top said no.
Right.
And held it up for, I think it was almost 3 years.
Yep.
When it was not even anything new. It was high-dose birth control,
Right,
which has been used since birth control pills have been around.
Right. Emergency contraception is a term I'm sure many people know.
Right. So this guy, his wife, broke her silence and did an interview, was it The Nation? Because the good Christian, dutiful wife could no longer stay silent.
Before that, though, if I can just insert here, because one of the things he really liked to brag about was a book that he wrote called As Jesus Cared for Women. And he gave this quote a lot, and this really made the rounds after he kind of said that in this article by The Nation. Right? And he wrote, "Even though I was trained as a medical specialist, it wasn't until I began to see how Jesus treated women that I understood how I, as a doctor, should treat them."
Makes me a little weepy.
It does.
Yeah, except that according to his ex-wife, he treated women in a most un-Jesus-like manner by sodomizing them against their will.
Yep.
And she said in print in this magazine that after 32 years of marriage, she could no longer keep quiet and finally stood up to 32 years of being anally raped in her sleep night after night. And I remember at the time when this came out, instead of denying it, his only defense was, it's dark and in the middle of the night. I couldn't tell the difference. So basically an OBGYN who couldn't tell his wife's vagina from her anus and just had no problem with raping her in her sleep.
Exactly. And, and he also had numerous extramarital affairs.
Always the best
he
hypocrite.
pressured his wife constantly to do things that disgusted her, like oral sex and anal sex. He wanted to pay her to be having sex.
To perform acts she hated.
Yeah. I mean, it's really unbelievable what this guy is really about. But again, as we said, this kind of goes out to
Classic
Dr.
hypocrite.
Hager, but also the Republican Party and Christian conservatives. And I want to end this with a quote from Wayne Besson, who was a reporter at the Falls Church News Press in Virginia shortly after this happened. And this prompted him, who is a socially conservative guy, a writer, just a great quote that pretty much sums it all up. It says, when a person says he is a social conservative, the first thing that now comes to mind is, who are you really sleeping with, and what deep, dark secret are you harboring? Conservatism is no longer a mantra, but a mask, hiding hypocrites and concealing closets. So for all of you closet dwellers, hypocrites, love to call out other people for doing what they do, but this is what you do when you are sitting alone in your closets.
He was focused on the family's physician resource council.
And I believe the head of the Christian Medical and Dental Society.
Medical and Dental.
Right.
It's Christian Dental Society.
Right. So apparently good teeth were important to him for some reason. Right. So again, for this unbridled hypocrisy, we salute you. I can't even call him doctor, but David Hager,
quit, right?
our Poetic Justice Hypocrite of the Week.
And that'll do it for this week's Sex in the News. See you next Sunday.
Thanks, and stay well.